Let's discuss diagnostic approach in Chinese medicine, the principles of diagnosis. First, the approaching patients holistically. The holistic approach to the patient has two meanings. In one meaning, the human body is taken as an organic whole, so that pathological changes in one region of the pathological changes of the whole body may be reflected in a local area. An illness in the exterior of the body can transmit into the interior. The illness of the visceral organs can be reflected in the exterior. For example, dryness of the eyes is usually due to deficiency of liver yin or liver blood, and inflamed eyes indicate heat in the liver meridian or strong heat in the lungs. If one sees only the local symptoms without regard to the analysis of the overall condition of the entire body, then it is difficult to arrive at a correct diagnosis. In its other meaning, the holistic approach emphasizes the mutual relationship between human body and its natural surroundings. Humans live in the natural environment and are affected at all times by weather and other influences. When there are unusual changes in the environment and the body fails to adapt functionally to these changes, and then illness may result. Hence, in order to make an accurate diagnosis, the physician must observe the patient's environment and incorporate this observation when analyzing the patient's symptoms. Number two, comprehensive analysis of all symptoms. Each of the four methods of diagnosis, history, inspection, auscultation, and olfaction, and palpation, collects clinical information and provides a unique approach to an understanding of the illness, and none can be replaced by another. To arrive at an objective and reliable diagnosis of all four must be employed in concert. Thus, clinical information on the development of the present illness, the evolution of the symptoms, past illnesses of the patient, and of the family members can be obtained only by taking the history, the physical condition and vitality, the complexion, and the behavior of the patient can be obtained only by inspection. The quality of the voice and the emanating odors can be assessed only by auscultation and olfaction. The pulse, which reflects the state of patient's illness, can be obtained only by palpation. Moreover, the occasion on illness may show false symptoms. On such occasion, the concerted application of these methods is especially important. Number three, diagnosis by symptom analysis and differential diagnosis. This means that in approaching a patient, the physician must determine the type of illness, then on the basis of the pattern of symptoms, the illness affecting the patient. Identification of the illness can convey much information on the entire course of the pathological changes, whereas the pattern of symptoms reflect the situation at a particular point of time. Determining the pattern of symptoms without ascertaining the diagnosis cannot lead to a firm grasp of the entire course of the illness and the mechanism of pathological changes. On the other hand, making illness diagnosis without differentiating the pattern cannot make rational treatment possible. In general, the symptoms analysis should precede differential diagnosis. For example, if a patient shows such symptoms as polydipsia, excessive thirst, polyphagia, excessive eating, polyuria, excessive urine, and emaciation, then by applying symptom analysis by the physician, can recognize and determine that the pattern of symptoms is one of diabetes. Then from the relative significance of these findings, the changes in the tongue and the pulse and the physical constitution and the condition of the patient can be further determined whether the illness is due to heat in the lung damaging fluids, blazing heat in the stomach, deficiency of kidney yin, or deficiency of both yin and yang. Once a clear diagnosis has been obtained, treatment can proceed accordingly. Thus, Chinese medicine treats every patient with an individualized protocol rather than using a common protocol for patients who suffer from the same illness. Thank you for your attention.